Always, we're joined by Dr. Syed Hussain from Trinity Health of New England. 4 topics we want to try to get to this morning. Good to see you again, Doctor.
Likewise, Tim.
And we are starting with a story that shocked a lot of music fans, country music fans. Toby Keith passed away from stomach cancer. I don't know that we've talked that much about stomach cancer. How easy is it to detect before it gets too late? I mean, are there symptoms we should be looking at?
Yeah, that's a great question, Tim. There's no screening per se. It's relatively rare in the larger scheme of things. About 1.5% of all cancers that are diagnosed may be stomach cancer.
Okay.
So using that logic, this year the CDC predicts there'll be about 27,000 new diagnoses of stomach cancer. What viewers need to keep in mind, what symptoms do we need to look out for? Include acid reflux, nausea, pain after eating, or early satiety, such as you feel full after a smaller meal than usual. So especially acid reflux. And sometimes we say, oh, I'm going to take an antacid. It's because of what I ate. But if these symptoms persist, please see a doctor. The threshold needs to be lower. We've also seen, even though overall stomach cancer rates have gone down over the last several years, we've seen an uptick in younger adults, so adults under the age of 50. Yeah. We still don't know exactly what it is, probably something related to food we're consuming, ingesting, but there is no screening per se for this type of cancer.
All right, so hopefully we will come a little bit further in the years on that. Just this week, state leaders launched a new campaign aimed at combating loneliness and social isolation, and this is after the U.S. Surgeon General also said just how much of a public health threat that is. I still feel like people have trouble connecting those dots because it's not so much a physical ailment. It's not easy to draw as clear of a through line from cause to problem, I guess.
That's right, Tim. And remember, there's a stigma attached to this too. So I'm very glad that the state is doing this, putting this at the forefront, just like it should, with other heavy topics such as obesity, gun violence, smoking, drunk driving. So it goes all the way up to that level, which means we will have resources, we will have more coordination between intergovernment agencies, campaigns, awareness, public awareness, and then also how do we partner with community organizations that already exist, right? That they're doing some of this work, but may need extra support and resources for this issue.
There's a new study out. I want to talk about this that appears to draw at least some sort of connection between taking drugs for erectile dysfunction like Viagra and a lower prevalence of Alzheimer's disease. It still seems like it's very early, and I don't know that this is actionable information.
It is, yes. This is a large study about looking at 260,000 men who were and who were not on getting Viagra for prescription reasons, and there seems to be an association with a lower incidence of Alzheimer's in individuals that were taking Viagra. This is not to mean that there's a causative relationship here. More research is needed. So I don't want viewers to start thinking, especially men, that now they need to all of a sudden start taking Viagra. No, that's not the main point here. But more research is needed. However, I do want to point out 2 medications that got recent approval for Alzheimer's hold a lot of promise as well.
Yeah. So we will probably come back to this sometime in a couple of years when they do more studies. Lastly, earlier this week, February 7th, was National Black HIV and AIDS Awareness Day, a disease that does disproportionately affect the black community. And while some progress has been made to reduce those rates and to lower that gap, of course, more needs to be done. What else can be done, and what is being done, Doctor?
Yes, great question, Tim. So more public awareness, especially targeted awareness in the black community, and partnering with community organizations. Because remember, we have to get down to the bottom, the root causes of all these health inequities that we see in minority populations. That includes easier access to healthcare, but also there's a level of mistrust with the health community. So that's why it's important we partner with health community organizations that may have credibility with these patient populations, and screening, as well as general education, the importance of pre-exposure prophylaxis, post-exposure prophylaxis when it comes to HIV prevention is important, as well as treatment.
Yes, it does seem like there's a lot of problems that can be fixed very early on in that sort of timeline, and that would be the place where I guess the smallest intervention can make the biggest amount of positive impact. Doctor, thank you so much for joining us today. A lot to get to.
Yes, thank you.
Again.